Informs, the largest association for the decision and data sciences, provides the following audio content to journalists for their use in reporting with proper attribution. What follows are 4 questions and responses from Julie Swann of North Carolina State. This is in regards to the emergence of the new Omicron variant of the COVID-19 virus. Julie is adjunct professor in the Stewart School of Industrial and Systems Engineering, and she is co-founder of the Center for Health and Humanitarian Systems. This is one of the first interdisciplinary research centers on the Georgia Tech campus. Question 1. What do we know about the Omicron variant to date?
The Omicron variant has a lot of mutations, actually quite a bit more than what we've seen on the Delta variant that previously came through. We also have some early evidence that suggests the Omicron variant is highly transmissible, and we know that it is in a number of countries worldwide.
Question 2. What don't we yet know about the Omicron variant to date, and what's being done to learn as much as possible as quickly as possible?
There are a lot of things that we still don't know yet about the Omicron variant. We're learning more every day about it. We don't know, for example, whether it causes severe disease or not. We don't know the extent to which it might be able to evade existing immunity, either from vaccines or previous disease. We don't know how widely it has spread so far and exactly how transmissible it is. There's a lot that's being done to determine more information about the Omicron variant. Scientists are using laboratory techniques to get an initial understanding of whether the variant can escape immunity from the antibodies brought on from vaccine. But the best data for that is really real-world data, looking at people who have been vaccinated and not vaccinated, and looking at the spread of the disease and hospital admissions and things like that. So that kind of analysis will take a little bit more time. But every day there's a little bit of new information about how wide it's spread, how transmissible it might be, or what kind of disease it can cause.
Question 3. What can people do to minimize their own personal risks with regard to the Omicron variant?
The most important thing that people can do is get vaccinated, and if they are already fully vaccinated, they can get a booster shot if it's been an appropriate length of time since their vaccination. They can also make sure that others in their household are vaccinating, including children age 5 to 11. The second thing that individuals and households can do to minimize personal risk is to wear masks anytime they're sharing the same air with people not in their household. And they can consider getting tested when they've been engaging with people or interacting in unmasked environments. These actions can not only help protect an individual and their household, but they can also make things better for the entire community by reducing the chance that our hospitals are overwhelmed.
Question 4. What are the larger and more long-term steps society needs to do in managing this variant and in anticipating future variants?
There will be other variants. It's essential that we have data systems where we are tracking the variants that are arising and sharing that information widely so that countries, states, cities, counties, companies, universities, schools can all take action. We need to make sure that we're investing in our infrastructure for testing and that we're sequencing enough samples that we know when a variant has arisen and what some of the differences are with previous strains. The most important thing of all is to get people vaccinated, not only in our own communities, but really worldwide. And that is what will help reduce the risk of future variants.
Please see the audio content release posted alongside this clip for attributions, soundbite length, and transcriptions. Any other questions can be sent to Ashley Smith, Inform's Public Relations Specialist, at asmith@informs.org.